Hi, I'm Yaz, the osteopath, physician associate, and some other kind of degrees and postgraduates. I've been saying for a while now, which has probably riled a few people up, that healthcare and medicine should be governed by engineers. This is exactly one of the case in points where I've just had a patient. They've said I can put this out in social media, but they came, I mean, I've been seeing them on and off for years, so they've known me for a long time, and they had an ankle fracture for which there was nothing to be done. But they told me that the consultant goes, look, you're going to get arthritis at some stage, and if the stiffness gets worse with recovery, then we might consider manipulating it. So he's come to see me after a year and a half, trying to, point his toes and lift his ankle up. And you can see the stiffness which has developed. And I looked at him, looked at the stiffness. I mean, he came in with a lower back pain because, loads shift and other injuries then occur and you've got to fix those, fine. Looked at his ankle and I was like, then I looked at the movement. Yep, it was stiff. Assessed the movement. I was like, it's called the subtalar joint, talocrural joint. But anyway, one of the joints were a little bit stiffer than it should be, which is limiting the movement. So I was like, well, at the end of your treatment, let me just mobilize it. So I mobilized the joint and I was like, here, now stand up and, lift your toes up and point your toes down and do what you need to do. Is the movement any different? And he's like, yeah, look, you could see the difference in the movement. So it wasn't me who said it, because he's an engineer himself. And he looks at me and he's like, when the doc said that to me, if it gets stiffer, then we'll go in and manipulate it. The first thing he thought back a year and a half ago is, well, why are you waiting for it to get stiff in order for you then to go in to treat the stiffness? Why don't you get ahead of the curve and then prevent it from getting stiff? And I just laughed because I've known him for a long time. So we just laughed at that. I'm like, thank you. This is why I say medicine and healthcare should probably govern by engineers, because of the way engineers think about problems. It's very different to the way I've noticed healthcare workers think about problems. I totally agree with him. We should get ahead of the curve and we should intervene with it and stop waiting for things to get worse. We did that over segue conversation. We did that over COVID as well, waited for people to get really violently sick, didn't intervene by giving them all the therapeutics you can give them to prevent them from getting really worse. And then unfortunately people passed, right? It's not a laughing matter, but we really need to change the way we think about healthcare. Thank you.